We have another minute to go. We'll start sharp at 1 p.m. Excellencies, distinguished dignitaries, esteemed guests, ladies and gentlemen, a very good afternoon to all of you. On behalf of Embassy of India, I welcome you all to today's event, Felicitation of Indian Doctors, COVID-19 Warriors, which the Embassy is organizing in association with the Indian Professionals Network, IPN Kuwait, and the Indian Doctors Forum, IDF Kuwait. In view of the prevailing pandemic situation, today's event is being held largely virtually in line with the COVID-19 related health and safety guidelines. Today's event is dedicated to our doctors as we specifically felicitate our Indian doctors who volunteered for free teleconsultations in 2020 to serve the needs for medical assistance and support from the Indian community in Kuwait. The felicitation ceremony for the Indian doctors will be followed by a brainstorming session to assess the current COVID situation, learn from the experiences of medical experts here with us today, and arrive at practical solutions, suggestions on what more we at the Embassy, community groups like the Indian Community Support Group, ICSG, all of us as individuals could do to curb the spread of this virus. This will then be followed by a prize distribution ceremony to be moderated by IDF Kuwait for felicitation of meritorious Indian students in Kuwait. Before we begin the official proceedings of the day, may I request all the esteemed guests who have joined us in this auditorium to continue to follow all the COVID-19 guidelines, especially maintaining social distancing and wearing of your respective masks properly throughout the program. Thank you for your cooperation in this regard. We begin today's event with a short audio-video clip which shows expression of gratitude to our frontline healthcare workers from the Armed Forces of India. A salute from the brave Armed Forces personnel to the brave Corona warriors. Now, to begin the official proceedings of the day, without further ado, may I now request His Excellency Ambassador of India to Kuwait, Shri Sibi George Sir, to come to the podium and address the gathering, please.
President of Indian Doctors Forum, Dr. Amir Ahmad, former presidents of IDF and other senior doctors who are with us today, President of Indian Community Support Group, Sri Rajpal Tyagiji, other members of ICSG who are present here today, representatives from various associations, esteemed members of the media community in Kuwait, distinguished guests, ladies and gentlemen, good afternoon to all of you, and a welcome to Embassy of India, Kuwait. I would like to begin my address by thanking His Highness Sheikh Nawaf Al Ahmad Al Jaber Al Sabah, Amir of the State of Kuwait, and His Highness Sheikh Mishal Al Ahmad Al Jaber Al Sabah, Crown Prince of the State of Kuwait, for hosting the large Indian community in Kuwait and for the care and support the government and the people of Kuwait continue to extend to the Indian community during the COVID-19 pandemic. As Ambassador of India to Kuwait, I am happy to see the excellent cooperation between our two countries in the healthcare sector in general and in the fight against COVID-19 pandemic in particular. Cooperation in healthcare was one of the main topics of discussion during the visit of His Excellency, the Foreign Minister of Kuwait, Sheikh Ahmed Nasser Al Sabah, to India in March this year. We will soon be holding the next meeting of our joint working group on healthcare very shortly. At the same time, our doctors, nurses, and other medical professionals, through their hard work and sacrifice, continue to save lives in Kuwait and continue to bring respect and admiration for their motherland. Dear friends, today's event is a really special event. It is to felicitate and honor our COVID warriors, our doctors who wholeheartedly served the Indian community during the hour of crisis, going beyond their call of duty. This is also a brainstorming session on what more we can do together to help the community as we continue to face the challenges of the COVID-19 pandemic. Every day brings in new challenges associated with the pandemic. Today, we are doing this event with our doctors in collaboration with IDF. We will soon do such brainstorming sessions with our other medical professionals and also to honor our nurses who are the frontline warriors. There is a resurgence of COVID-19 infections across the globe. While some countries are going through the second wave of peak infections, some other cities and countries are already entering the phases of third and fourth waves. This does not augur well for us. This means we have to confront this deadly pandemic for some more time to come. These efforts have to be invariably led by our brave frontline healthcare professionals, our doctors, our nurses, and our scientists. They have toiled hard for over a year now. They have been working selflessly in trying to protect our lives and that of our dear ones. And while doing this, they are putting their own lives at risk and that of their family members at risk. Despite all the odds stacked against them, despite all the pain and suffering from working long hours, spending sleepless nights, witnessing unpleasant scenes of deaths and losses, our healthcare professionals have not thrown in the towel. They are truly an embodiment of indomitable human spirit. They have displayed true courage, fortitude, and resilience. We need to honor them and we need to thank them. Dear friends, coming specifically to today's event, it is a small gesture from our part to express our gratitude and say from the bottom of our hearts, thank you to a team of doctors who partnered with us, offering free medical teleconsultations to Indian nationals in Kuwait during the peak period of the COVID-19 pandemic in 2020. The timely medical advice and the counseling support offered by these doctors is invaluable. It helped save many lives and addressed an urgent need of the Indian community at a time when this deadly virus was far lesser understood and the requisite support structures were still being addressed. I also thank Indian Doctors Forum, its president, Dr. Amir Ahmad, its immediate past president, Dr. Surinder Nayak, who was the president when the teleconsultations group was formed, former presidents, office bearers, senior doctors who have joined us today. I thank IDF for its continuous humanitarian efforts and its many endeavors in supporting the Indian community, including its efforts to fight the pandemic and generate awareness among the community and others on the issues associated with the pandemic. As I said before, we wholeheartedly appreciate the crucial role being played by our nurses and other paramedical staff during this crisis. They have staunchly formed the backbone of all the healthcare operations during the pandemic. Management of day-to-day care of all the patients, personal attention to the well-being, physical and mental, of all the affected individuals, providing the essential backup and support. That is what our nurses and paramedical staff were doing. They have witnessed and endured all the pain and suffering and have soaked in all the pressures like shock absorbers. We will soon organize a special event to felicitate these brave warriors and also hear their views and suggestions on the way forward. Dear friends, we in the embassy will do everything we can to help support the community in this crisis. Despite all the challenges, we continue our consular services. We had a few cases of infections in the embassy. We managed it pretty well. We tested them multiple times. All my staff members were tested multiple times in the last couple of weeks and months. We treated them, we home quarantined them, we did contact tracing, but we made it a point that our consular services and community welfare efforts will continue without a break. It makes each of my officers and staff members in the consular and community welfare wings and every member of the mission a COVID-19 warrior. I thank ICSG for the proactive role they continue to play with our many Indian associations and groups to ensure that no Indian goes hungry. Yesterday, ICSG has relaunched its food material distribution campaign. We in the embassy will continue to use ICWF Community Welfare Fund resources to provide food, medical assistance, shelter, and air tickets to the need. Our vaccine registration counters in the embassy continues to be functional and is being used effectively by the Indian community in Kuwait. As I said before, as we have many experts joining this event today, I would also like to take this opportunity in engaging in a brainstorming session to draw insights from their experiences and come up with practical suggestions and an action plan for all of us, individually or collectively, to effectively deal and fight against this pandemic in coming days and weeks. I would like to hear from them that what more can the embassy and the ICSG and the IDF together do to help those in need. I'm sure that with all the collective talent we have with us here today, we will be able to come up with some concrete, effective, and implementable suggestions. I am eagerly looking forward to these discussions and deliberations. Dear friends, I know that the COVID-19 situation here in Kuwait, like the rest of the world, remains challenging at this stage. Many may need expert medical advice to cope up with their illness and many may even need assistance to deal with the mental stress on account of the pandemic. To address these challenges, IDF has once again volunteered to provide free medical advice and counseling support through teleconsultations to the Indian community in Kuwait. A panel of Indian doctors from different specialities has been specifically constituted for this purpose. Please refer to the embassy's advisory that is being released shortly for all necessary details, including general instructions for teleconsultations, timings for these consultations, contact details of panel doctors, Indian languages spoken by each of our panel doctors, and so on. I encourage the Indian community members in Kuwait to avail this facility. We are all in this together. We will collectively fight this battle against this deadly pandemic in coming weeks and months. I would request all of you to continue to follow all health and safety precautions and guidelines related to COVID-19 as part of our individual responsibility in this battle against the pandemic. Be safe, be healthy, follow all protocols and guidelines, and keep each other safe as well. Thank you.
Thank you very much, Excellency, for those insightful remarks and also for placing today's event in the right context. Thank you so much. I request you to stay here on the podium as we will move on to the felicitation ceremony. But before we move on to the felicitation ceremony, for all the young students who have joined us here today, we have a few quiz questions. This is an on-the-spot quiz. Please feel free to participate, and there are prizes to be won as well. So here's the first question of the day. Which city in the world reported the first case of COVID-19? I repeat, which city in the world reported the first case of COVID-19 infection? Can you raise your hand, please? This is only for students. Yes, please. Well done. Please come to the dais and receive your prize from His Excellency the Host. Miss Nivedita, congratulations. Can we have the prize for our young winner, please? Congratulations once again. We will now begin the felicitation ceremony. To begin the ceremony, may I request the following dignitaries to join His Excellency the Ambassador: Dr. Amir Ahmed, President of Indian Doctors Forum Kuwait; Dr. Surendra Nayak, former President of IDF; I request both the doctors to remain with His Excellency throughout the felicitation ceremony. May I also request Dr. Ramesh Pandita, a former president of IDF, to join the dignitaries on the dais. The first doctor that we would be felicitating today here is Dr. Alexander K. John. Dr. Alexander, may I invite you to the dais, please? Next, we have Dr. Abdul Muhammad Shukur. May I kindly request Dr. Shukur to come to the dais? So, next we have Dr. Amit Kunjumon. Dr. Amit. Next, Dr. Amit. Next, we have Dr. Anita Kunhikrishnan. So, Dr. Anita Kunhikrishnan. The next doctor after Dr. Anita would be Dr. Anthony Sebastian de Cruz. Dr. Anthony Sebastian. The next doctor after Dr. Anthony is Dr. Arun Joshi. Dr. Arun Joshi. After Dr. Arun, we will have Dr. Asha Varghese. Dr. Asha Varghese. After Dr. Asha Varghese, we have Dr. Ashok Bihari Deb. Dr. Ashok. Dr. Ashok Bihari Deb. After Dr. Ashok, we have Dr. Bibi Dhanan. May I kindly request Dr. Bibi Dhanan to also be ready? Dr. Bibi Dhanan. Next we have Dr. Blenda Cristina D'Souza. Dr. Blenda Cristina D'Souza. Next we have Dr. Christina James Irwin after Dr. Blenda. Yeah, I know. Thank you, Dr. Pandita. May I request you to kindly take your seat in the auditorium. May I now request Dr. Riaz Khan, a former president of IDF, to join the dignitaries on the dais for the next round of felicitations. I would now request Dr. Farha Amanullah Dalwai. After Dr. Farha, we have Dr. Jasneet Kamal Narang. Dr. Jasneet Kamal Narang. Then we have Dr. Nalini Ravichandran, followed by Dr. Narendra Agara Venkataswamy. Dr. Nalini Ravichandran. बोल दिया. Followed by Dr. Narendra Agara Venkataswamy. Dr. Narendra Agara Venkataswamy will be followed by Dr. Felipos George. Then we have Dr. Prerna Deshpande. I'm sorry. Then we have Dr. Ram Kumar Gupta. Dr. Felipos George. Dr. Felipos George will be followed by Dr. Ram Kumar Gupta. Dr. Ram Kumar Gupta. Dr. Ram Kumar Gupta. I've just been informed that Dr. Prerna Deshpande is also here with us. May I invite Dr. Prerna Deshpande after this? We have changed once now. Dr. Prerna Deshpande will be followed by Dr. Ramesh Pandita. Dr. Ramesh Pandita. I would now like to thank Dr. Riaz. May I kindly request you to take your seat in the auditorium. Thank you. May I now request Dr. Vinod Grover, another former president of IDF, to join the dignitaries on the dais for the next round of felicitations. For this, I would now like to invite Dr. Rayavaram Raghunandan. And followed by Dr. Saroj Balagrover. Dr. Rayavaram Raghunandan. Dr. Saroj Balagrover would be followed by Dr. Shekhar Lamthade. Dr. Saroj. I've just been informed that Dr. Rekha Rubin is also here. May I request Dr. Rekha Rubin to come to the podium. Come to the dais, please. Dr. Rekha Rubin. I've just been informed that Dr. Rekha has joined. So. Okay, so we'll have Dr. Shekhar because he's already in the queue now. Dr. Shekhar Lamdhade. Then we'll have Dr. Rekha Rubin, who will be followed by Dr. Sujata Krishnakumar. Dr. Sujata Krishnakumar. Dr. Sujata will be followed by Dr. Susovana Sujit Nair, and then we'll have Dr. Syed Farooq Hussain Belgrami. We now have Dr. Sujata Krishnakumar. Dr. Susovana Sujit Nair. Followed by Dr. Syed Farooq, who would be followed by Dr. Tahseen Khan. Dr. Syed Farooq Hussain Belgrami. Dr. Tahseen Khan will be followed by Dr. Warke Alexander. Dr. Tahseen Khan. Next we have Dr. Warke Alexander, who will be followed by Dr. Yashpal Manchanda. Dr. Warke Alexander. Then we have Dr. Yashpal Manchanda, who will be followed by Dr. Yasir Peringattu Todial. We now have Dr. Yasir. Then we'll have Dr. Amir Ahmad himself. Thank you very much, Excellency, and all the dignitaries on the dais. May I request all of you to take your respective seats in the auditorium, while I request Dr. Amir Ahmad to stay on the dais, and I request him to gather the address the gathering, please. I'm sorry for that.
Honorable Ambassador of India, Shri C.B. George, President of the ICSG Group, Mr. Rajpal Tyagi, members of ICSG, Mr. Ashok Kalra, Mr. Mr. Suri, Jitendra Suri, Mr. Raven, personals from the media, and my dear friends and children. Assalamu alaikum, good afternoon, namaskar. At the outset, Your Excellency, on behalf of the entire Indian Doctors Forum, let me express our heartfelt thanks and gratitude for this generous gesture of yours. The last committee led by Dr. Surendra Nayak, Dr. Mohan, I think he's here in the audience, Dr. Mohan, yeah. And the entire team did a fantastic job when the pandemic started. And upon the advice of the then ambassador, started this teleconsultation. IDF is IDF mainly because of its members. Our strength, our biggest asset are our members. Right from the time IDF was formed in 2004, from the then late founder of IDF, late Dr. Namburi sir, followed by Dr. Ramesh Pandita, Dr. Riaz Khan, Dr. Vinod Grover, Dr. Abhay Patwari, Dr. Surendra Nayak. It's a movement. We are just carrying on the baton. And the wonderful thing is, our members are, as time passes by, getting better and better at what they are doing. And that is reaching out to the community through its various community welfare activities. Today, Your Excellency, what you saw, the people you felicitated here, are people who rendered teleconsultation. There are many others who gave teleconsultation, but their names were not there in that list. There were others who rendered lectures, talks, webinars, thereby creating health awareness. Many others through radio talks and TV. And the IDF symposium that was so wonderfully arranged, so beautifully arranged, which had a massive turnout of people viewing and a lot of positive feedbacks. So this is just a small, very small sample of doctors, but there are a larger number of doctors who are still continuing to do these various wonderful community welfare services. Definitely in the future, we'll have another opportunity to see to it that those doctors' services are also recognized and they too are felicitated. Coming back to this felicitation, this is the first of its kind that we had. This is something that is each and every one of us over here. From our bottom of our hearts, we want to thank you, thank the officials at the embassy for recognizing our services. We, as a forum, as a members of this prestigious forum, we are there, sir, 24/7. You just need to call us, we'll be at your service. Whatever it takes to improve our bilateral relationship, to improve the health services over here, which already the government of Kuwait, they are doing a fantastic job. But we are only supplementing, we are just adding on to it. So whatever needs to be done, because as a very large expat community, the largest expat community, 1 million, probably 30% of the entire population over here. It's a significant, and that's a burden, huge burden. We as doctors, as members of this forum, assure you, sir, whenever you call us for whatever services, we will be there upfront, sir. With these very, very few words, I would like to once again thank Your Excellency Shri C.B. George and the officials at the embassy for having arranged this beautiful program for the members of IDF. Thank you, sir.
Thank you, Dr. Amir. Now, before we begin the next element of today's program, we will have the second question for the young students. Second quiz question, that is. This is I think a fairly easy one. It's in a true or false format. The question goes like this. COVID-19 has currently been detected on all 7 continents. Is this true or false? Please raise your hands. Do we have a raised hand? Yes. Did you say true? Well, that's not the correct answer, unfortunately. There have been no cases detected so far in Antarctica. This is as per as per the latest available information that we have. I'm sorry, so let us have the third question then. I want to see a winner here. This is a multiple choice question. We are all good at it. I hope so. How many vaccine candidates for COVID-19 have been proposed so far? A, 30, B, 60, C, 90, D, more than 120. I'll repeat the question again. How many COVID-19 vaccine candidates have been proposed so far? A, 30. This is a number. So, A, 30, B, 60, C, 90, D, more than 120. Do the doctors want to win the prize? Do we have one of our students? I'll give the privilege to the students first. So, essentially, we have various vaccinations being developed around the world by companies, various medical research institutes. Some of them have been approved, whereas some are in various stages of development. So when I say proposed, I'm including every single vaccine that is currently under various stages of development. Yes, at the WHO. As I said, I see hands raised, but from doctors and media community, members of the media community as well. I have a young student right at the back of the auditorium. Please. Yes, it is. Congratulations. Can you please come up to the dais? So, may I request you to present this? This can be, okay. Thank you so much, sir. Miss Pooja is the winner. Miss Pooja, you are. Congratulations. So, may I request you to stay on? We'll ask one more question then. Thank you. Our fourth question of the day. Well, this is not a multiple choice question, neither is it a true or false question. You have to give me the correct answer on this. What is the name of the COVID-19 vaccine that has been indigenously, please note this word, indigenously developed by India and currently being used in India's vaccine program, which is the largest vaccination drive in the world? No multiple choice. Ma'am, I'm sorry, I'll first give the privilege to students, like I have been doing. Students, if you have been watching or following us, the youngest participant, I presume, in our auditorium today is raising the hand. Absolutely. Please come to the dais and collect your prize. Covaxin is the answer, which has been developed by Bharat Biotech in collaboration with the Indian Council of Medical Research (ICMR) and National Institute of Virology (NIV). Congratulations. What's your name? Miss Christine Sikvera. Congratulations. Excellent. Thank you, sir. The next element of today's program is the brainstorming session that Ambassador also had mentioned in his remarks. So here we have a few questions that we have formulated in advance for this brainstorming session. I'll throw the question. Some of them are particularly directed towards the medical experts we have here today, the doctors. Here goes the first question for our analysis, collective analysis here. Indian doctors in Kuwait have played a crucial role in the contact tracing exercise that was carried out last year in Kuwait, which formed a key component of the COVID-19 containment strategy. So, what are the essential learnings from this exercise, and how can we apply those learnings today for curbing the spread of infection when we are going through a second phase? Dr. Sajna Mohammed, yes, you have raised your hand. Would you like to come to the podium and answer this? Thank you, Doctor.
Good afternoon, everybody, Your Excellency, and all assembled here. As a person involved in contact tracing, I would like to answer this question. Definitely, there was a lot of learning involved last year, especially because it was all new to the whole world, and everybody, including the medical personnel, were not aware of what it would finally, the outcome would be and all that. Now, I would just like to explain what is contact tracing and how we did it, so that everybody is aware of what we did. Contact tracing is a systematic process where we try to identify people who have been in contact with infected people. We call them, we advise them on what are the measures they should take to isolate themselves, and then how to use proper sanitization measures, use of mask, etc. Now, by doing this, I can just tell an example. Suppose there are 100 people in a population. 10 of them are found to be positive. Another 10 may be positive but not detected. And the remaining 80 people may be negative. Now, by identifying 10 people, we ask them to isolate and we prevent them from spreading it to others. Now, the 10 people who are still positive but unidentified will be still moving around and they will give the infection to others. So by contact tracing, we are trying to find out whoever has been in contact with a positive case, and we do the testing in them so that we give the necessary advice on what they have to do, isolate themselves so that they prevent further infection. Now, supposing among 20 people, that is the 10 I said and the next remaining 10, we find out around 17% people out of 20. We are able to isolate 17 and only 3 people remaining will be out to spread the disease. So by finding out significantly higher number of people, we were definitely able to reduce the spread of disease among the population. Though the numbers must have significantly appeared higher in the beginning, which caused anxiety among many people, definitely the first phase we were able to reduce the spread by the timely contact tracing. Now, as you said, that it was a huge learning process. One thing we learned by contacting people was that it was a warm welcome to most of the people, the general public, when a doctor contacts them directly. They had a lot of anxiety, firstly related to the outcome of it was very uncertain what would happen. There was a lot of financial insecurity, stress related to the entire pandemic, about what we ourselves never knew what is the further progression of this pandemic. So by reaching out to them, they were all at ease that they could at least vent out their queries and frustrations and whatever queries in relation to the pandemic from a proper personnel who could guide them in the proper way. And by doing so, we also felt that, it was like a counseling session. We were made aware of a lot of difficulties these people faced, either let it be in that home or at their workplace or in the quarantine centers where they were already admitted. And they were also given access to the telephone numbers of most of the doctors who they could approach at any hour of need, and thereby went out all their queries and concerns. So this was a very positive aspect of contact tracing. Secondly, we also found that by doing this, we could break the chain. That is the first and most important actually. We could break the chain of spread of the virus and thereby curb the spread of the disease. And we could give all necessary advice and whatever was needed to prevent further spread. Now, the second part of the question, what we can do further to do this is, like, we have to have strong public awareness campaigns which should be more assertive, and we have to give the right and timely information to the public so that they are aware of whatever has to be taken care of and all that. And also we have to be equipped ourselves to encounter any possible surge in hospital admissions. The doctors have to always be in the forefront. We have to give our best to help out the public and be prepared for anything in the future that could go on. Now, this is like a war. We have always heard that societies at war they generate better ties. So the corona pandemic is far from a war, but we all have to be in it together. So once we have this collective action, we can always prevent, we can realize what people are going through and collectively come out with something to prevent further worsening of the pandemic and control it. Thank you.
Thank you, Dr. Sajna. Well, we have a second question. This is open again to all the doctors here. So, all the doctors who had volunteered for teleconsultations last year may have received a number of calls from the community seeking expert medical advice. So the question is, did the doctors notice any general medical inquiries, a trend in that? And if yes, could you please elaborate and share the advice rendered for the benefit of the participants today, as this advice may be of equal relevance even today, or more perhaps. Dr. Yasir? Yes. May I request you to come to the podium, please? Thank you.
Good afternoon, everybody. Actually, very important question. As a team of IDF doctors, I was part of this telecommunication team. And indeed, it's a very good initiative from the Embassy of India. Thank you, the ambassador, and all the administration of Indian Embassy for that. Especially, I know Dr. Surendra Nayak and his team played a pivotal role in this initiative. Anyway, I will share my experience in this regard. Basically, first case of corona was reported, what I remember is 24th of April, 2020. Then I think there was a sense of, anxiety and apprehension among the Indian community, basically. And from the March 1st onwards, I think the people were in a tense situations. So at that time, what I remember is a lot of community groups, like community welfare groups, started these telecommunications of their own. But fortunately, Indian Embassy came forward and started this initiative by 22nd April. That's what I remember, 22nd of April, I think. And 20th of April, yeah, first notification came from 20th of April. 24th April, that's I remember, 24th of February 2020. Yes, yes, from which came from Iran, I think. So in March, basically there was a huge panic among the public, and at that time, a lot of community groups. I think there is so many to name actually, but they were doing their own in their own circles. They were doing community services, but 2020, April 20, I remember, this committee has been formed, and so many people gave their name voluntarily, and we started this exercise basically. But it was a very beautiful thing to do. When we look back, actually satisfying things to do actually. So in my experience, initially it's all regarding the pandemic itself. The people wanted to know how it spread. People wanted to know how it get treated, what is the best treatment. If I get infected, will I get a bed in the ICU? Will I get a bed in the hospital? There were a lot of queries actually. So all these things has been dealt in good. I think to the patient satisfaction, we were able to answer these questions. But lately, when all the flight services has been cancelled from 15th March, I remember, 7th of March, sorry. So what happened is, a lot of people taking medicines from India were unable to get medicines for their basic medical problems like hypertension, diabetes, and all these things. So next, the query started asking whether we can take any other alternative, or can we get medicine from Indian Embassy, or can we get medicine from any other group. Luckily, thankfully, a lot of community welfare groups came forward and supported IDF. Thanks to all of these organizations, they supported IDF in full swing, and we were able to provide. Even I took medicine from what I remember. I took medicine from Dr. Surendra for distribution among the patients, free of cost. We used to deliver at their doorsteps. This was actually a magnanimous thing to do, actually. So, yeah, thanks for those groups and office bearer. And next thing, when the pandemic, when the time passed, lately there were a lot of psychotic anxiety problems regarding the disease itself, and from the panic, lost job, people has been confined to the places, and all these things made them psychologically anxious basically. So this has been also dealt by our IDF doctors well, I think. But basically, we were educating the patients of all basic things like to keep the social distancing, to frequently wash the hands, and to keep the face mask, to avoid the crowded places, and go. Basically, we asked them to confine their houses and only necessary to go out to the public places. So this was basically advice given by us, and there were a lot of queries regarding those patients who have symptoms but didn't test positive actually. So their apprehension was how to test, to get test for the corona, or how to go about basically. So basically we advise them if possible, but what I remember in last year, there was very few facility for getting corona tested, I think. But at that time, private hospital did not have the license to do the corona testing. So most of them were only in the general hospitals. So very few people got tested actually, and most of them we treated symptomatically. But the things have been changed now. All private hospitals are doing, even though they take money, but you will get the report in hours basically. So at present, in the present scenario, if somebody called us, we encourage them to get tested, because there will be a clear picture whether they have a corona or a simple flu. In that case, it will be easy for us to manage the case actually. So in the present scenario, it's still, the spread of infection has not been ceased. It's still going on. So the basic step like wearing the face mask, frequently using the hand sanitizer, or washing the hands, and keeping the social distance. This has been proven in studies basically. All studies says these three steps play a pivotal role in preventing the infection and controlling the corona spread actually. So there is a lot of things to say, but I think the time is limited. So I would thank IDF, the president at that time, and the Indian Embassy, and His Highness Ambassador, and all the administration who worked together to make this support group and supported the Indian community. Thank you very much.
Thank you, Dr. Yasir, for sharing your experience. Now, taking a cue from what Dr. Yasir said about the stress and anxieties, our next topic is counseling support that was offered by Indian doctors to the community to cope up with the stress and anxiety related to COVID-19. I would request one of the doctors to briefly talk about these mental health issues pertaining to the pandemic situation, and also to advise on how best to cope up with this and how best to deal with these issues, especially extreme cases leading to suicidal thoughts. Can I request the doctor to suggest ways of tackling this issue as well? Can we have any? Yes, oh, no, Dr. Susovna is also, okay, I'll invite both of you. I'll start with Dr. Susovna first, and then, Doctor, may I request you to stay in the queue? Thank you.
His Excellency, Ambassador Sir, all my IDF members here, all my senior IDF President Sirs, embassy officials, the media personnel, ladies and gentlemen, good evening one and all. It's a great opportunity actually to speak about our experiences during contact tracing. As an oncologist, I had to listen to most of the patients who were diagnosed with cancer that time and who had appointments in KCC but in our hospital, but they were not able to come because there was a sudden shutdown of the OPDs. It was a real havoc indeed. People were going through the stress of being diagnosed with a cancer, and on top of that, neither they were able to travel back to the homeland, and neither they were allowed to come to our hospital for their treatments. It was creating excessive amount of stress. As Mr. Fahad said, it was even leading to tendencies of suicidal tendencies. During those times, it is as understandable that, as my previous speakers also said, Dr. Yasir and Dr. Sajna, that none of us knew exactly what's happening and what's in our next step. The stress level for the doctors, for the nurses, because we were all afraid of even getting ourselves exposed to the disease. That time what we found, many of the patients who contacted us, that they somehow wanted to get the treatment done. There were people who were suffering in the MISREF, quarantine centers. They were suffering from extensive bleedings or severe pain. We were not able to reach out to them so easily. But somehow, as the teams started forming up, our IDF team members started forming up with the help of the nursing staffs also. We tried to send medications from hospital, strong painkillers, to be supplied to them. Even some of the Indian associations helped through embassy portals to repatriate them back to India. And that time even our previous ambassador, sir, he was also very helpful in that sense. We received many help from their side to get the patients back to their country. There were some associations who were even helping to get the tickets. Monetarily, they were helping them. And indeed, it's not only the patients. I think each one of us have gone through, and even we are still going through, heavy amount of stress. Really, COVID-19 pandemic has kept us all with lot of negativity. But as human beings, we cannot stay back with negativity. We have to keep life going. So in that sense, the question that was formed was like, how do we keep our positivity intact? We have to understand that life cannot go without trial. As we are all locked up, we can think of we can channel our thinking, we can channel our intellects into different modalities. We can think of new things to do at home so that we don't feel bored, we don't get stressed. We can even improve our relationship with our near and dear ones who are far apart from us by maintaining contact with them on virtual grounds. Though we are not connected to each other, we are not able to meet each other, but this physical distancing does not mean social disconnection or social furtherness. We can keep contact with them. That can bring down our stress level a lot. We can be more of positive thinkers. We can keep our spirituality intact. We can make a daily routine of having some sort of yoga and meditation to keep the positivity around us. We can keep contacting all our senior people who can give us well wishes and thereby keeping the positivity intact. Regarding our patients, that time especially the cancer patients, where we as oncologists, we understood that there were cases which were diagnosed in later stages, where we have to go for, we call neoadjuvant treatment, like we start with chemotherapy so that we can downsize the tumor and then the tumor goes for surgery. But as surgeries were all closed down that time, so many of the patients were kept aloof of chemotherapy, because chemotherapy, as we all know, reduces the immunity level, and that can make the patients more prone to develop COVID-19 related severe illnesses. They may land up in ventilators very soon. So that was also a big setback in our profession during that time. Many of the patients who required chemo, we had to put them on hormonal treatment, knowing that hormone will not do the effect which we expect from chemotherapy. So in spite of all those things, we somehow managed to continue with that. Now we have almost reached a stable condition. We are somehow trying to make each case individual based, like which case requires immediate attention. We are going for that case at the first, keeping the cases which can be waited for some time for a later date. But still, for each case, each cancer case, we have something called multidisciplinary team meetings, where all the different departments like medical oncology, surgical oncology, and radiation oncology, we do discuss the case to find out which should be the best option at that time to get the better benefit and a better prognosis in the future time. So somehow we have tried to come down to a stable condition at the present, but as the cases are rising again, somehow the things are not looking that great. But I think once we maintain the protocols, we maintain our social distancing, keep washing our hands and putting the masks, and getting ourselves vaccinated and encouraging people to get vaccinated, I think we can somehow reach again to a better life very soon. So as doctors, one of the most elite communities in the society, we have to encourage people that how important it is to get vaccinated. Whenever it is available for each person, we should get vaccinated. No need to think which company, how is it, the complications. Everybody will not suffer from the complications. So we need to get vaccinated as soon as possible so as to protect ourselves as well as to protect our community and our own people. With that, I would end here. Thank you so much for this opportunity. Stay safe, stay blessed. Thank you.
Thank you, Dr. Susovana. The fourth question of the brainstorming session is again to the doctor. Yes, Dr. Philippos would also like to share his experiences on the counseling support offered.
Good morning, one and all. At the outset, I am not a public speaker. This is an extempore thing which I thought I'll tell. Thank you, Your Excellency, and all the members of IDF and other the organizers for for allowing me to speak a few words. At the outset, what the first speaker and the second, Dr. Sajana and Asir and Susan said, I fully agree. But that's the positive part. There are a few negative parts and my own experiences. Contact tracing, I am a part of contact tracing. I still counsel. Counseling goes back to 2, 3 in the night. I never stopped counseling. Much before the committee was formed, and I thanked Dr. Surendra Naik, because he is the one who initiated. Much before that, I had started counseling on my own. I am not a qualified counselor, but I am a practical counselor. Then the same team of Dr. Surendra Naik was carried out ably by Dr. Amir. I am very happy to say that IDF has done a wonderful work. And I have not only counseled Indians, I have thrown my door open to every people of the world. I have Kuwaitis, I have Filipinos, I have Bangladeshis. When you look into the deeper aspects, you feel very sad. Contact tracing was good, but the negative aspect of that towards the end, when they were quarantined, the barbed wires were put, people 10 to 20 people in a room, okay? One guy has it, he is quarantined along with the 20 people, the rest of them used to get. And they used to call me. I used to try to get the ambulance. The ambulance used to come to that place but go back empty-handed because they were not allowed. These were the practical difficulties at the later stage of contact tracing. So, and second part what Dr. Asir said, I fully agree. What Dr. Susanna, and all of them are wonderful. They have helped all my patients. Dr. Susanna especially helping cancer patients, which was the need of the hour. Dr. Arun Joshi, for that I think, he has, all of them, Dr. Farooq, I am naming only, okay, but everyone has helped me continue this. But the aspect I am going to deal very briefly about the last part. I have met with patients after counseling. My minimum counseling is 1 hour. I can testify it, I can vouch for it. Some of the staff nurses, they were working without masks, without anything, treating COVID patients. They used to come and cry. I said, God will give you. I am a Christian. I believe in God above. And I pray for all. For me, religion is not. It's in my heart. I do what is right in the eyes of God. Like, for me, there is no religion, no caste, community, creed. I believe in the patient. This is coming from the heart. This is an extempore speech. I am not prepared for it. So I told about counseling. This is one patient in file. He called me at about 10 o'clock. His friend called me. He said they has locked the room and he is going to commit suicide because he was positive for COVID. I was stunned. I said, okay, please give the phone. He refused to talk. Then I talked to him for 6 hours. He said, "Njan marikkan pova. Njan chaakan pova. Enikku vayya." He is married with 2 kids. I counseled him for about 6 hours, ultimately succeeded in turning that suicidal tendency. Then he came, visited me. I work for Sur Clinic in Mahabula. It's a small clinic. I'm a small-time GP, not a big, but though my body is big, but I work in a small clinic. Okay, so he came to me. Then I asked him, do you want to commit suicide? He was laughing because the way I talked to him, and he approached several others, but he was not responding to any of them. So my advice to my friends and colleagues here, when a patient calls, please don't cut them off immediately. Spend at least 15, 20, 30 minutes with them. That's enough. Even if you don't give medicines, that's okay. All they need is some open ear to hear. Because it's a desperate cry for help. Please don't turn away anybody who calls you. I have had calls, after the pandemic started, night and day I didn't know. In my clinic, outside the clinic, Filipinos, non-Indians, then Masri, that is Egyptians, Filipinos, Kuwaitis, Sri Lankans, Bangladeshis, everyone has, I've been able to be with them. So my sincere request to all of you, this comes from the heart. I am not prepared, I am not a public speaker. That's why I refrain from any of the public affairs, speeches. So I sincerely request every one of you to spend at least 15-20 minutes with each of the patients to allay the fears. That's all I request from my colleagues here and the various organizations. And when I received the prize, I told His Excellency, it's not for me. I'm just a name. But there are hundreds, thousands more who are working, the silent workers. So I said, I received this by the grace of God on the behalf of my family, my colleagues, my friends, my patients, and everyone else who are unseen, unheard. Because I know a lot of people, the security fellow, he checks it, he is exposed to this, he is not afraid. The police personnel, everyone, the embassy people. I know, personally I know many of them here in the embassy. Incidentally, for 2 occasions, one was His Excellency Excellency C.B. George had called me to check the shelter. I went, as soon as I said, I'm ready, I'll come. And before that, the former ambassador also called me. I went and checked all the inmates because they were dead afraid that, they were so afraid, terrified that the Kuwaitis in that area had spread COVID to them and they were all going to die. So I assuaged all their fears. I spoke to them and they liked it. Okay, so my sincere request to who are much more qualified than me, who are much more experienced than me. I am 62 years old. I have 2 grandchildren. That grandchildren, I have 2 daughters. One is a doctor. She's a professor in KMC. The other one is in Australia. So I stand before you and request each one of you take up counseling as much as you can. And provide whatever you can. The words itself will go a long way to help assuage the fears of not only the Indian community, but all other communities. Thank you so much for this brief thing. It comes from my heart. I'm not prepared for this. I just thought I'll add on to this. And I thank all of my colleagues here who have helped me with all these patients, especially the poor patients. If I name one, all of them have helped me. Right from Surendra, from Amir, when I approached different thing, to all of the doctors, in time of crisis, they have always let me a helping hand. Even the embassy, I think Sibi, the Secretary Sibi, he also used to help. All of them, Anuradha, all of them used to help me a lot. Thank you so much, one and all. Thank you.
Thank you, Dr. Philippos. Coming specifically to the current situation, I request the doctors to throw light on the current resurgence of the COVID-19 infections across the world, including here in Kuwait, and give their expert opinion on the essential precautionary measures all of us need to follow at our homes, at our workplaces, and whilst in public to protect ourselves and our loved ones from this infection. Yes, Dr. Arijit. Dr. Arijit.
Honorable Ambassador, His Excellency, and respected dignitaries present in the hall. I am Dr. Arijit Chattopadhyay, Consultant Endocrinology and Internal Medicine at Al Sabah Hospital, Kuwait. I am literally witnessing this pandemic, COVID pandemic, unfolded in this country right from the first case which was reported on 24th February 2020. In fact, the first group of cases, a group of Iranian people who was taken by the Ministry of Interior staff, and they were having classical manifestation of COVID-19. They were initially brought to Sabah Hospital. In fact, that was my on-call duty, internal medicine on-call duty. And our junior registers, they assessed the patients while the patients were there in the ambulance, and then shifted to Jabbar Hospital for further management. I was initially, for the initial first 4 months, directly responsible taking care of COVID patients. And I was heavily occupied, so I took exemption by requesting my colleague Dr. Surendra Nayak from the teleconsultation because I could not take part. I was heavily occupied in this. Today, what we find, there is resurgence of COVID patients, and we are still continuing with the bitter pandemic of COVID-19. There are two sides of the story I must highlight here: the viral aspect of the disease and the human aspect of the disease. COVID-19, we all know, it's very clear to us because we are all going through a lot of information. I say information superhighway, that it's an RNA virus. At the same time, COVID is a very tricky and clever virus. RNA virus has an inherent tendency to keep changing their features. Medically, we call them as genetic shifting of their nature, drifting and shifting. And unfortunately, what has happened due to some sort of selection, some of the mutated form has come up and being reported in various parts of the world. We know that after slowing down of the pandemic, somewhere between September and October, the first group of reported strain, mutated strain, were reported in UK, followed by Brazil, South Africa, and now even in India. And this is precisely the reason that there is resurgence of the cases. And let me make it very clear that even those individuals who suffered from a COVID earlier, from classic COVID-19, are still susceptible to catch this infection again. Number two, what about the behavior of this mutated strain? Please remember that as such, whatever information we have, the incubation period, the clinical manifestations are more or less is the same. The only difference is the transmissibility, what we medically call as secondary attack rate. In case of classic COVID infection, the secondary attack rates was less, but some of the mutated variation, secondary attack rates are more. That's why we are getting more number of cases. More number of cases means more number of clinical manifestation, more number of hospital admission, unfortunately, more number of ICU admission and mortality. If we go through the statistics for last 2 months, right from 8th January onwards in Kuwait, the number of cases started rising. And if you see last 6 weeks, it's almost like 1,500. Remember that we are not testing all of them. Many mildly symptomatic or simple cases, we are simply advising them to the standard practice of quarantine and isolations. There is lockdown in place for last 1 month, more than a month now. So this is the story of the virus. Now, what is about the human aspect? In terms of human aspect, there is a collective responsibility for all of us. If we want to win this battle, there should be safety for everyone. It's not an individual battle. But this can be achieved at 3 stages: at individual level, at family level, and at the level of society. At individual level, which we all keep telling, there are 3 pillars: wearing mask, do hand sanitization, and keep a social physical distancing. What about the family level? Please make sure that your house is clean, dust-free. Those who smoke, they should not smoke. Try to make sure that your windows are open, sunlight comes in, well-ventilated, well-aerated room. This is very important. At the same time, improve your immunity. I am not just saying for the sake of saying. Good sleep, stress reduction, healthy diet is important. We are all carried away by multivitamins, vitamin C, zinc. They are there, but these are very important, including stress reduction. Because if your immunity is strong, you can fight this germ. Even if you catch the infection, it will be a mild one. Now, coming to a collective responsibility, we cannot escape from the point of vaccination. Effective universal vaccination is very important and the need of the hour. Many people keep asking, doctor, should I take Pfizer vaccine, Covaxin, Covishield, Johnson & Johnson? This is ridiculous. All vaccines are effective. They have passed through so many clinical trial and stages. It's something like you are using a variety of mobile phone, whether it is iPhone, it's Samsung, it's solving the equal purpose. So please improve the awareness. We have to make sure that vaccination is done effectively. Now, many patients keep asking, doctor, I have vaccinated, but still there are reported cases. It is true. In America, last week, CDC reported out of 6.6 million people who vaccinated, 5,800 people got the COVID infection. I am not refusing that data. 78% died. Just imagine the other side of the story. These 6.6 million people were not vaccinated and got the COVID infection. What could have been the mortality of these people? So just see the difference what this vaccine made as impact. Actually, by vaccinating, what we are doing? We are improving our immune system. We are training our immune system. I simply use the term as a common man term called T cell and B cell. T cell are called as a teacher cell, and B cell are actually boys cell. By vaccinating, you are training them. First, you are priming the teacher cell. This teacher cell will in turn prime and train the boys cell. So whenever the corona enters in our body, it will not be life-threatening. It will not lead to so-called serious pneumonia or thromboembolic complications. So what we are going to do is actually, literally, we are taming the virus. Vaccine will not prevent from the virus from entering from one person to another person. Here comes the importance of wearing mask all the time, doing hand sanitization, because if we want to break the chain of transmission, this is very important. So irrespective of our social or economic background, we have to fight this battle collectively if we want to win against this bitter pandemic. Thank you.
Thank you, Arijit, Dr. Arijit. Now, a question from all the parents. Some of whom are here with us today in the auditorium, and many others are participating virtually and watching us live. There are reports of increasing infection among young children. Could the doctors talk about the causes of this development and suggest specific remedial measures for safeguarding our younger ones? Dr. P.S.N. Menon. Thank you, Doctor.
Thank you for giving me this opportunity. His Highness, His Excellency, Mr. Ambassador C.B. George, my dear colleagues, friends. We have been hearing a lot about pediatric infections increasing all over the world, not only in Kuwait, but unfortunately, the data that is available to critically evaluate whether there have been a rapid rise in children is very difficult, because most of the data is actually from the social media and is not authenticated. Also, there is a difficulty because what constitutes children is different in different countries across the continents. In Kuwait, children constitute actually those below 12 years, whereas in USA it is 18 years, in India it is academically 16 years, and in Australia and New Zealand it is even 20 years. because they combine adolescents with children. So the data cannot be compared across the continents to give a clearer picture whether there have been a rapid surge in the number of cases of children getting COVID infections. However, the Center for Diseases from USA has clearly shown that since February 2021, there has been a rapid rise in the reported number of cases in USA. Before February, it was almost 13% of all the cases of COVID reported in USA were among the pediatric population. But after that, in the first week of April, they have said that 18% of the cases that is reported in USA are among children, that is below 18 years. Such data is coming from other nations in Europe as well as from trans-Pacific countries, and many of them have tried to look at, is it because of a particular mutant that is seen which is responsible for pediatric infections. And there have been some reports to suggest that at least in USA, there is a specific variant which has been highlighted by Dr. Arijit, responsible for pediatric infections, which is much more severe and also is not amenable to routine management protocols advocated. What about Kuwait? At the moment, we do not have any statistical data authenticated by the government or Ministry of Health which says what is the type of infection, how much it is prevalent among the population, and whether there are any mutant strains. What about India? India, there has been reports now coming from the National Center for Disease Control from New Delhi and from the ICMR. They have reported that there is definitely a mutant strain causing severe form of disease in larger population of children across states. And they have now labeled this particular strain as the new double mutant strain. In Indian version, it is also called the Deshi strain. That is what they are saying, which is responsible. And they have said that it is actually a mutation which has been seen in other continents. And in fact, actually, the strain that is seen in India, reported in India, is a mixture of, or a hybrid of, the South African, the UK, and the Brazilian strain in some way. The mutation doesn't mean that there is only one mutation in the gene. It's actually in that particular strain, there are even up to 10 to 15 mutations occurring, including in the part of the spike protein, making it sometimes non-amenable to the vaccines currently available in the country, which is worrying. So at the moment, the data which has come from the state of Maharashtra, which is seeing the highest peak at the moment, 60 to 70% of the samples comprising from pediatric population are showing mutant strains from. It is worrying. So is it limited to Maharashtra? No. The last report from the CDC, that is the NCDC from India, show that similar cases are reported even from Uttar Pradesh, Chhattisgarh, Delhi, and Gujarat. So it is widely prevalent in the country. It has not come from one particular region or people traveling to one area. Who are the children who are getting these infections? It seems to be more common in older children above 6 years. The newborns are relatively well protected, but from the first month onwards, the first year of life, there seems to be more severe attacks than the rest of the children. So they are the ones who need to be protected. That means that we have to elaborate probably and elucidate a new vaccine strategy for children. Please note that we are not currently recommending any vaccination for children. So it is the need of the hour. We have to see which vaccine will be most suitable for children. it is also important to know that are all children equally affected? Like in adults, there are certain comorbid conditions which makes more children susceptible to COVID-19 infections. Children who are obese, children who are diabetic, children who have a strong family history or personal history of bronchial asthma seems to be suffering from more serious forms of COVID-19 in India. So we still need more studies, more observations, more public awareness about that children can be affected by COVID-19 and they can have a serious disease. So let us care for them. Let us include them in all our programs for containing COVID-19. Thank you.
Thank you, Dr. Menon. Although COVID-19 and its multifactorial nature would mean we can go on with this brainstorming session, but we have time restrictions. So one final question for the doctors today. We would like to get suggestions from you all on what more can the embassy do to assist our nationals here in Kuwait during these challenging times. Also, please share your suggestions on what more can the Indian Community Support Group do to support the embassy in ensuring the welfare of our community here. Oh, Dr. Amir Ahmad himself has volunteered. Thank you, Doctor.
Two very important aspects raised by Mr. Fahad. What the IDF can do, sir, is we can address this issue on a community level, where definitely any help from ICSG would be welcome. When I say community level, reach out to the community, conduct health awareness through webinars, find out what difficulties they have, probably distribute now, only food is being distributed, probably distribution of medicines, and such programs on the community level. But what I would like to say over here is what IDF can do at the government level. So as I mentioned, the members of this forum are our biggest asset. Each one member in this forum is a gem. He or she has his own sphere of influence. And in Kuwait, it is this Vasta that works. So we need to know what IDF can do at the government level when it comes to health. There was recently the visit of the foreign minister, as Your Excellency just mentioned. And there is this joint commission, ministerial joint commission. And one of the aspects mentioned in that is health. So there IDF can play a role. We could think about establishing a health center, Kuwait Health Center back in Delhi, so that medical tourism, cases that are being now presently sent to US, Europe, and other places, probably could be sent to India for treatment purpose. We could think of training the Kuwaiti doctors over here. They go down to Europe, they go down to Canada, they go down to States. Our culture, our food habits, medium of teaching being English, all these are what is matching with the criteria that's mentioned over here, even the cost factor and the closeness. So that's another area where so your office could deal, with Government of India and Government of Kuwait, and IDF could play a role in all this. So there are many such ideas which definitely we'll share with you as you're here with us for some time and IDF is still there. On the community level, presently, vaccination is a problem. As mentioned, 1 million Indian expats over here, 30% of the population. Reaching out to them is a big problem. Procuring the vaccines by the government of Kuwait also is a difficulty. Talking to the Ministry of Health, talking to the government of Kuwait, whether we could request the government of India to send us vaccines. And then, to reach out, vaccinating 30%, taking up that responsibility of vaccinating 30% should be it will reduce the burden that's there by the local government. And we could administer these vaccines through the various private Indian clinics. They would do that without because these vaccines cannot be administered, they need a medical setup. So that's something that could be seriously considered. We could do that with ICSG, get ICSG also involved in that exercise. These are few points that come into my mind, and as mentioned to you earlier, Your Excellency, we are there at your service. Anytime you call us, our members are there to help you. Thank you.
Thank you, Dr. Amir. With this, we come to the end of the brainstorming session. Before we move on to the next element, which is the prize distribution ceremony, I would like to correct one of our earlier errors. We have not kept pace with the rapidly evolving situation. So absolutely, we did a fact check on one of the earlier quiz questions. It was a true or false question whether whether COVID has reached or affected all 7 continents, and one of our young participants had said true. I stand corrected. May I request you to come and collect your prize, please? May I request His Excellency the Ambassador to come to the dais and thank you. Can I know your name, please? Namish. Master Namish is here with us. Congratulations, Master Namish. So may I request you to stay on the dais? We have one last question from the quiz contest. Here's the question. I think this is the easiest of them all. Name the vaccine that Kuwait imported from India. Before you jump to your answer, remember this is the name that you need to give is the name, is the Indian name. The manufacturer is the largest manufacturer of vaccines in the world. So a bonus if you also answer the name of the manufacturer also. Children first. I see many hands from the doctors. I'm sorry, I apologize. Children's. I see an embassy staff also raising his hand. Children, please. Yes, here we have one. Serum Institute is the manufacturer, yes, but the original question was, name the vaccine. Absolutely, Covishield. Please come to the dais and collect your prize. This is her second prize of today's event. Congratulations once again. Thank you, sir. The next element of today's event is the prize distribution ceremony. This will be moderated by the Indian Doctors Forum. May I request Dr. Anila to come to the podium.
The Honorable Ambassador of India to Kuwait, Sri C.B. George, officials of Indian Embassy, President of Indian Doctors Forum, Dr. Amir Ahmed, office bearers of IDF, ex-presidents of IDF, and other members, IDF COVID warriors, our meritorious students, their parents, a very good afternoon to all of you. It's with immense pleasure and pride that I stand here before today. This day is one day which we all look forward to. Our own IDF children has made this day possible. These children, or rather, I must say these lovely young ladies and gentlemen, has proven again and again that there is no shortcut to success. No one becomes victorious by mere luck. It's just that the more harder you work, the more luckier you become. I can see the gleaming eyes of the proud parents sitting there. We all, being parents, want to thank you children today for making us extremely proud. We, being doctors with hectic work schedules, and many of us being frontline COVID warriors too, in this pandemic situation, we couldn't be there with you at all times. But still, you children managed to put in all your efforts with patience, understanding, without complaining. And that too, in this pandemic situation, you have done a marvelous job. Once again, we are extremely proud of you. We pray to God that He may grant you good health and wisdom in forming a good person and giving you all the opportunities to achieve all your dreams in life. Thank you. May I invite Dr. Sunil Yadav, our Vice President, to address the children.
Good afternoon, everyone. His Excellency, Mrs. C.B. George, our senior colleagues, members, and our children. This is in fact a proud moment for us. We, as IDF office bearer, we take pride and we enjoy this day. This is our celebration day, success of our children, our own children. And as Dr. Anila mentioned correctly, that this has been a challenging time for them. There was disruption of their classes. There was online classes, their schedules were not sure, no surety about the exams. And the children of our members, they have done excellent, good job, and they have got good positions in various universities. Some of them are already joined online or physical classes. Some of them are still waiting and here. So it's our opportunity to celebrate this day for our children, for their success. And IDF has been doing this since last more than 15 years. And as I mentioned, this is a special day for us. And let's enjoy. And I will invite Anila to count the names and start the process of felicitation of our meritorious students and their parents and families.
I'll be calling out the names of our students. But first of all, I would like to invite our Excellency Sri C.B. George onto the dais. I also invite Dr. Amir Ahmed, our President of Indian Doctors Forum, and all the office bearers to also grace this dais. The first student is Master Advaid Ashtikar. Advaid Ashtikar. He is the son of Dr. Kanchan Anand Ashtikar and Mr. Anand Ashtikar. He completed his 12th from the Indian Educational School. Master Anand. Advaid Ashtikar, I think he is not there today. On behalf of Advaid Ashtikar, it's his mother who will be receiving the gift from the Indian ambassador for Advaid. For his 12th standard, for his meritorious performance in the 12th standard. Thank you, ma'am. Our next student is Alivia Jasvi. She is the daughter of Dr. Tasneem Jasvi and Mr. Amba Jasvi. She completed her 10th standard from Macrovision Academy School at Burhanpur. For Alivia, this time her mother, Dr. Tasneem Jasvi, will be receiving the certificate from our ambassador. Next, we have Angelina Mariam Koshi. She is the daughter of Dr. Reena Kurian and Dr. Vijay Koshi. She completed her 12th grade from Indian Community School, Kuwait. No, they are not here. Now we have Aham Munawar Mohammed. He is the son of Dr. Sajna Mohammed and Mr. Munawar Mohammed. He completed his 10th standard from Delhi Public School, Kuwait. Aham, Master Aham. Next, we have Esther Anil. She is the daughter of Dr. Sajni Matthews and Dr. Anil Thomas. She completed her 10th grade from Delhi Public School. Miss Esther. We have Meet Chandresh Kumar Shah. He is the son of Dr. Swati Kapadia and Mr. Chandresh Shah. He completed his 12th standard from the Indian Community School, Kuwait. I think he is not there today. Yeah. Can we have next student, Namish Bafna. He is the son of Dr. Ritu Bafna and Dr. Piyush Bafna. He completed his 10th grade from Delhi Public School. Master Namish. Namish Bafna. Yeah. We have Neha Elizabeth Thomas the next. She is the daughter of Dr. Aji Mariam Thomas and Dr. Thomas K. Epen. She completed her 12th grade from Kamil School, Kuwait. Oh, sorry. Her father, Dr. Thomas K. Epen, will receive the certificate on her behalf. Next, we have Nivedita Behju Balan. She is the daughter of Dr. Shaiji Kumaran and Dr. Behju Balan. She completed her 12th grade from the Indian Community School, Kuwait. Miss Nivedita Behju Balan. Congrats, Nivedita. We have Pradyumna Samir Vaidya. He is the son of Dr. Anantapriya Vaidya and Mr. Samir Vaidya. I think he is also not available today. We have Pranay Manchanda. He is the son of Dr. Dolly Chopra and Dr. Yashpal Manchanda. He completed his 12th grade from Delhi Public School. Pranay's mother, Dr. Dolly, will be receiving the award on behalf of Pranay. Next, we have Prisha Shankar. She is the daughter of Dr. Gayatri Kritika and Dr. Shankar Raman Nagarajan. She completed her 10th grade from Delhi Public School. On behalf of Prisha, her father, Dr. Shankar Raman, will be receiving the certificate from our Honorable Ambassador. Our next meritorious student is Ms. Rida Shimaz Huda. She is the daughter of Dr. Sabina Tasneem and Mr. Noorul Huda. She completed her 10th grade from Delhi Public School. Ms. Rida. Next, we have Sharda Sujit Nair. She is the daughter of Dr. Sushovna Sujit Nair and Mr. Sujit Nair. She completed her 10th grade from Delhi Public School. Ms. Sharda on stage. Her mother can also join her. Next we have Sophia Sequeira. She is the daughter of Mrs. Shyamal Sequeira and Dr. Richard Sequeira. She completed her 10th grade from the Indian English Academy School, Kuwait. Ms. Sophia Sequeira. Congrats, Sophia. We have Suhira Mujib next. She is the daughter of Dr. Kutsia Khatun and Dr. Omar Mujubuddin. She completed her 10th grade from Jabriya Indian School. Ms. Suhira Mujib. With this, we come to the end of the felicitation ceremony of our meritorious students. Thank you, Mr. Excellency. Thank you so much. And once again, wishing all our wonderful students a bright future ahead. Thank you so much. Now I invite Dr. Nazim Parker for the vote of thanks.
Good evening, one and all present at this August gathering. I, Dr. Nazim Parkar, General Secretary of Indian Doctors Forum, on behalf of the President and the entire office bearers team, feel privileged and honored to deliver the vote of thanks. At the outset, I would like to express my heartfelt gratitude to the Ambassador of India to Kuwait, His Excellency, Ms. Shri C.B. George, for granting us his prestigious premise to host our IDF event today. His efforts in recognizing our contributions towards the COVID pandemic will surely go a long way in encouraging us further to do more. I would like to thank all the embassy officials as well who provided us with the support and assistance in conducting this event in an effortless and smooth manner. We have today in the audience amongst us special guests who have braved their way to join us during this felicitation and are torchbearers of the Indian Community Support Group. I will fail in my duties if I do not appreciate and recognize them for initiating the community services during the initial stages of the pandemic. They have played a crucial role in undertaking a huge responsibility of supporting our community with essential provisions and services. I would like to utilize this moment and extend our heartfelt gratitude to you all and your esteemed team. I would like to thank all the proud IDF members who have joined us today, along with their children, for the meritorious award ceremony. We all are indeed proud parents of the children who have managed to perform successfully despite all the challenges put forth during these difficult times. Heartiest congratulations on their truly deserved achievements, and we are positive that they will succeed in further in future endeavors. I would like to thank all the press and media officials for capturing such a favorable ceremony and creating memories of a lifetime for all of us. Last but not the least, I would like to thank all the past presidents of IDF, all the esteemed members of IDF, and the proud parents for their gracious presence today at this auspicious event. I would like to take this opportunity to encourage one and all to keep serving the community in their own special way so that we can continue to earn faith, trust, and accolades from our fellow citizens. Thank you, one and all. Okay. I would request all the meritorious students present over here to come for a group photo with the IDF office bearers and His Excellency Shri C.B. George.